Here is an eminent researcher, Dr. Anitha Mahadevan garu in front of us, who has attended to this 3 days International Symposium on new discoveries on brain and disorders, which has a lot of excitement opportunities, which is being hosted by A.M. Reddy Memorial College of Pharmacy, which is being sponsored by International Brain Research Organization and ANRF, Anusandhan National Research Foundation. Welcome, madam. Welcome for this 3 days international conference.
Thank you very much.
Your presence has added a lot of energy to the young researchers in our A.M. Reddy Memorial College of Pharmacy. Ma'am, here are the few questions to you from the students' side. What kind of changes that a human has to do in accordance with the present disorders that has been occurring in the brain?
You're talking in terms of
what kind of precautions that a human has to take and what kind of modifications that has to take.
Okay, I think first off, there are several answers to we don't have about brain and its disorders. But a question that is repeatedly being asked is about healthy brain aging.
Yes, ma'am.
Because with life expectancy increasing,
Yes, ma'am.
the statistics are very scary.
Yes, ma'am.
Neurodegenerative disorders is probably going to be one of the most common.
Yes, ma'am.
But if you ask about how to age healthy,
Yes, ma'am.
there is one thing that I think research has shown, and that is to keep your brain active.
Yes, ma'am.
You know, we are like a car. If you don't use it, parts are going to rust and then it won't move.
Yes.
Your battery will get discharged.
Yes, yes.
So how do you maintain a car?
It has to be
You do
used.
servicing, you have to use it all the time. Brain is also in the same way. Now, to keep your brain active, it is not just by solving Sudoku puzzles. It is not by just watching television. The activity that is supposed to keep a brain most active is to learn something new. You know, it's like children's brains are always more active because they're always constantly learning something new. And that is something that we should do as we age. It can be anything. It can be learning to sing if you don't know music. It can be learning to paint. It can be learning to use social media. That's also a very, very difficult skill as we age.
Yes, ma'am.
But the most important is supposed to be learning a new language.
Absolutely, ma'am.
Yeah? It's also shown that being multilingual protects us from dementia.
Yes.
So there are several factors. There is food, there is microbiome. So all of these we have to find out in India what are risk factors that promote and what we can do to prevent it. The second message would be, I think yoga and meditation are two very important things that we should get back into our culture.
Madam, what are the few suggestions or the advices that you can give for the young researchers in the field of neuroscience and
There is so much to be done. I think they need to get curious.
Yes.
They need to ask questions.
Yes, ma'am.
And have that passion to find answers.
Yes, ma'am.
India should be the ones who should be giving answers because we have large number of patients.
Yes,
So which means we have a lot of material.
Yes,
We have the technology. We have the brain power. So I think our youngsters can do it. All they need to do is set their mind to it.
The last question, ma'am.
Yes.
It's very interesting question that how we can pull up the Indian people to attract towards this brain banks.
Okay, actually I was here to talk about the brain bank.
Yes, ma'am.
Our brain bank in India, which was started by my mentor, Dr. Shankar,
Yes, ma'am.
it was the first brain bank set up in 1995.
Yes.
It was set up by Dr. Shankar with one principal objective, and that was to give brain tissues collected after death of a person to scientists in India to do research.
Yes.
Because the brain disorders like dementia, psychiatric disorders are seen only in human beings. You don't see it in animals. So if you want to do research on it, you need human brains. And that is why it is very, very important to have human brain tissues, both from diseases as well as people who don't have disease. In fact, that is even more important. We call them controls.
Yes, yes, ma'am.
Because only by comparison we can tell which is abnormal, which is normal. So if we bank that and make it available for researchers, youngsters who want to do research in the country, that would be the biggest, I think, gift that we can give future generations.
Yes, ma'am. Yes, ma'am. And the last question, ma'am. How we can collaborate with all other agencies in India for the research in further coming days?
I think there's only one answer to that. You ask and you shall receive.
Yes.
So I think all all of us need to understand that we need to keep applying to funding agencies. Now there are so many, all willing to give funds.
Yes, ma'am.
We need to just ask.
Thank you, ma'am. Thanks for your valuable presence here. Thank you once again.
Thank you.